Well, welcome to my Focus On update. This month I'm going to focus on COPD. And I know that you've done a lot of work in this area, so I'd like to introduce you both because obviously the listeners would like to understand your background. So we've got Wendy, who's part of our service transformation team, and Heather, who's part of you're a commissioning manager, aren't you? So this is really interesting for me because when I look at the number of readmissions we have to hospital, to the acute hospital, then the greatest number are for COPD reasons. And there's a history, isn't there, in this conurbation because we had a lot of cigarette factories and so forth. So this is quite a disabling disease. So I'm really pleased with the work that you've been doing, but I thought it'd be helpful to look at the changes that you have made and the impact. So could you tell me a little bit about when you started off on this programme? Because how long ago is it now?
So we initially started in January 2018 with a number of, sort of an overview of some of the data that was driving, as you've just mentioned, in terms of the prevalence and the severity of the COPD within the local population. And out of that we ran a number of workshops to develop some themes and some ideas that we could work upon, predominantly around self-care, self-management, primary care, management and identification, non-elective admissions, as you've referenced. We have a lot of people that come in with quite severe COPD, how we then support them post-discharge, and also sort of around advice and guidance, how we link in our GPs into sort of consultant-led information from our respiratory consultants, and that kind of framed a lot of the work that we decided then to do.
So basically you're working with the community to ensure we stabilise and patients can play a key role in managing their chronic disease, but also when they do come into hospital, what you're trying to do is make sure we can support them in terms of their discharge and wrap services around them immediately back into the community.
Yes.
So it's helpful from two perspectives.
I think one of the key things was as well the early identification of patients with COPD. So we did quite a few events in the different neighbourhoods for patients that hadn't been diagnosed, so we could increase prevalence of COPD, which we've done considerably over the last 2 years, because obviously they're being managed within primary care, we've got a diagnosis, they're being managed within primary care, monitored, regular annual reviews. There's evidence that they will not come up into the acute setting. So we've done a lot of work in our GP practice, they've done a lot of work on the identification over the last 12-18 months.
And how does that link with some of our other services that we offer that we've developed over a period of time? I was just thinking about the extensive care.
Yeah.
So I mean we've worked quite extensively with the extensivists in terms of how we work across the system to support people once they're discharged, because a lot of it's anxiety that goes along with COPD. A lot of people that come in who are readmitted, it's because they're anxious about managing their condition, and we were conscious that once they were discharged there could be a bit of a time lag before they were picked up by some of our services who could support them in the community. So we have started a supported discharge team where people who are at the severe end of COPD are assessed by an acute respiratory response team who assess them within the ward environment, whether they need additional support out in the community. They're then referred and seen within 72 hours by the extensivist care team under the sort of, we call them the supported discharge team at the moment. And we've been doing that since 17th of December last year, 2018, with monthly reviews on how that's going, and that seems to be working exceptionally well to support individuals, both in terms of self-care and self-managing, feeling sort of more confident about their condition, and knowing what's normal for them, but also appreciating what matters to them in terms of the support that they need.
And when you say what's normal for them, I understand that you've introduced some of these wristbands.
Yes, yeah. So we kind of linked into AQUA, the Advancing Quality Alliance, and one of their AQ collaboratives is around COPD. And one of the first ones that we went to, I think I took a number of individuals with me, And they mentioned there was somebody giving a presentation on the oxygen wristbands from Wrightington, and they've also been used down in Derby as well. And that's to sort of, it's a little bit of confidence, but also for if NWAS, the North West Ambulance Service, came out, and we're visiting somebody who was breathless, it's appreciating what their normal saturation levels should be, so that we're not bringing somebody into our emergency department when their saturation level is normally around about 90%. So that's kind of a bit of a confidence for them to know that that's normal for them, but also for any healthcare provider that comes into contact with them. So that we've started that, and that's going very well as well.
Good. And what's the feedback you're receiving from patients and their families?
Well, we've got somebody on our programme board,
Yeah.
so Ian Kenworthy, who's actually part of the local Breathe Easy group, and we've had him with us from the beginning, haven't we?
Yeah.
And he's been very involved in sort of feeding back. I've been to their Breathe Easy group a number of times to kind of say what we're doing and give an update. And they've been very positive about how much we're trying to change things, how much we're listening, and how much we're engaging with them. So very positive.
Ian's been a really vital member of the programme board right from its inception, really, and he's put some really, really useful comments. I think from a patient perspective, he's been a really vital role, hasn't he? So we can look at services we've got and how we can improve, and his input has been really, really invaluable. And
some challenge as well sometimes when you sort of you get along doing what you've always done. It's hard when somebody says, well, actually, why are you doing that?
Yes,
and
absolutely.
you know, that doesn't work for me. Can we do it differently?
Yeah.
So he's been very valuable for that.
Yes. And are you, will you, as part of this programme, be measuring patient confidence levels? Because you've obviously tried to look at improving self-management, aren't you? And because it's very difficult for patients when they have difficulty breathing, they do become anxious. So it is trying to provide them with the tools to try and manage their anxiety and how to manage their health a little bit better than they are doing. So how do you intend to evaluate that going forward?
So as part of the NHS Innovation and Technology Tariff, the CCG were able to apply for some My COPD licences free under the tariff, which we did, and Tameside and Gloucester have got 850 free licences. So the licences are for patients with severe COPD and the lifelong licences. So patients will be able to, it's a web-based app. Patients will be able to go into the app and look at all the different elements of their COPD care in an attempt to self-manage their condition, including pulmonary rehab, inhaler techniques, what services are out there, just as an aid for patients to be more aware of their condition. And hopefully over the next 6 months we will have the 850 licences out there with our severe COPD patients.
Excellent.
And as part of that, there is actually what we're hoping to do is a Greater Manchester evaluation of that implementation, but also in terms of the supported discharge team, we've got the patient activation measure. So the team are using that as an evaluation tool in terms of, do people feel more activated but more confident as well to self-manage.
So as you develop this programme further, it evolves, what do you hope to achieve at the end of the programme? What would good look like from your perspective, or a patient's perspective?
I think good would look like a reduction in non-elective admissions for COPD patients and readmissions, and patients just be able to have the confidence to self-manage appropriately, or ask for a healthcare professional's advice as appropriate, but know what their condition is and how to manage it. And so hopefully reduction in GP appointments and acute admissions.
And I think also early identification of individuals with COPD. So a bit similar to lots of long-term conditions, some people don't necessarily come to the attention of healthcare professionals until they get to sort of moderate to severe. So some of the engagement work that we've been doing with GP practices and with Be Well Tameside and Live Active is how do we identify those individuals earlier, so that we're optimising their care but also helping them to stay healthier for longer.